Well, hello everyone, and welcome to Health Chats Among Friends. My name is Deidre Kindred. I'm a nurse advocate, educator, and navigator. And tonight I have the true pleasure of talking with my friend Janet Standifer, who is a dementia consultant. So, hi, Janet.
Hi, good evening.
Oh, good evening, good evening. So, Janet, tell the audience a little bit about yourself.
Well, I have been very, very interested. It's my actual passion to work with families and caregivers who are taking care of someone who is living with dementia. And I've been working indirectly with people who are living with dementia as a speech and language pathologist for the last 39 years. During that process, I noticed that there was a huge lack of information and formal education for families and for healthcare professionals and just the community in general on how to care for someone who has been diagnosed with dementia at any of the stages. So, with that being said, I decided that I will continue to work as a speech pathologist with patients. However, I needed to fill that void with these families, and I decided to go ahead and seek multiple certifications and to become a dementia trainer and a consultant. Also, with tagging that on, I'm also a certified virtual dementia tour trainer, which means I can provide the virtual dementia tours through Second Wind Dreams, which is a hands-on tour where each participant wears different types of garb, and they go through a process and a journey to understand what it feels like to have cognitive loss, sensory loss, visual loss, auditory loss, and neuropathy issues, and so on.
Wow.
So they really actually can feel emotionally, mentally, cognitively how it is to have those losses, those senses are gone slowly
Yes,
dwindling away.
it's very
Um,
eye opening.
my ideal world is to put someone through the tour first, and then they have a better understanding of what their loved one is going through. And then at that point, once that loved one says, "Oh my gosh, I had no idea that mom could not see everything around her. She can only see things that are in the middle." Or she
Hmm.
didn't comprehend what I was saying to her, and that's why she became so frustrated. So, or when they're trying to feed themselves, they've lost those fine motor skills, so they cannot hold the utensil or they can't sequence it up to their mouths. And next thing you know, they're losing weight because they can't feed
Yeah.
themselves. Those are just a very few amount of examples on what kind of problems commonly happen with the families and with someone living with
Yeah.
dementia.
Well, that's amazing. I
So,
want to jump in. I'm sorry. I want to jump in right there because you it's so much that we can hone in on too. So I like to talk about number one, the dementia tour. I've done it twice, and it was so eye opening. I think anybody who knows someone or loves someone or likes someone should go through that. So I want you to talk about, is there a facility that you have to set that up at, or can you do that in the home, or how does that work? Because it's an amazing experience.
what I have done in the past and am currently working on as soon as the COVID
Yeah,
situation resolves
right.
is facilities have offered their place, and we set aside 3 rooms, 3 to 4 rooms, depending on the size of the rooms, to have the tour. I've had churches offer to use their space, police departments, their space, anyone that would like to offer their space, and I could utilize it to set up the tour. It
Mm.
does require it's a very long day, but the tour is usually open half a day or for a full day, depending
Mhm.
on how many participants sign up for it. And
Mhm.
the tour itself, I would average 30 minutes per person. Once they come in, put the garb on, and then they go through the tour, and there's some other things that happen after that. No one leaves without me talking with them. because
Right,
many people are very disturbed about what's happening and they feel guilty. And that's one thing I do not want anyone to feel guilty
right,
about.
right.
If you showed up for the tour, then you're invested in your loved one. And
Absolutely.
that speaks 1,000 words.
It does, because
Yes.
well, my mindset when the first time I did it, being a nurse, you know, I was like, oh, I'm going to go in here and I'm going to do this and I'm going to be able to, you know, pick up the things that they told me to pick up and all the just different directions they were throwing at me. I was like, I can do this. But it was so eye opening. That tour needs to be called a walk in their shoes
Yes.
because it
Yes.
was amazing, because the mind is such a amazing organ. And I advise anyone who knows someone with dementia or thinks they may have it or lives with someone, go through that experience. It is definitely an eye-opening experience. So I'm glad you
Yes,
can
it
take that to churches. So we need to get the word out for, when
is.
COVID starts to dwindle down to a controllable state, that everybody needs to experience that. I think it needs to be at every church. And as a matter of fact,
It's very it's extremely effective when a person's trying to learn how to take care of a loved one or take care of their residents,
right.
anybody that has anything to do with
Yeah.
someone living with dementia, even
Yeah.
elder care lawyers, businesses,
Absolutely.
people that work at the
Absolutely.
grocery stores. And we do have a program that can be modified for families.
I was getting ready. That
So
was my
we
next one.
go in the home and they could actually go through the program as well. And it's set up just for families. And I have one that's actually set up for first responders. So
Okay.
they're more than welcome to go through the general one, but I do have one specifically for hospitals and for first responders because the scenarios present themselves a little bit differently.
Oh, that's awesome.
And then once people have gone through the tour, it is now time. They say, "Well, what do I do?" Now that I have this information, I'm more aware of what my mom or dad or brother or sister or residents going through. What do I do with this information? And that's where I say, okay, it's time for you to get some training and understand what's going on in the brain, understand the different um, progression, different
Hmm.
types of progression of the disease, and what happens with each. I want to call each level,
Right.
and then teach them techniques on how do we handle certain things, and those techniques change as the
Yeah.
person's dementia progresses. We're going to have to change our approach. We
Right.
cannot expect the person that living with dementia to make any of those changes. Now, I guess you
Nope.
figured that too.
Oh, yes, ma'am. Yes, ma'am. It was a experience, and I went through it twice on two different occasions. And each time it was an eye-opening experience, and it helped me be more empathetic to people that are going through that. It's just something else. So I wanted to also talk about your groups. You had mentioned groups that you educate.
Yes, prior to COVID, I was involved with actually a facilitator for a Parkinson's support group and various dementia support groups, and that was put a little bit to the wayside. And now what I'm doing is I'm speaking online to different groups that are running dementia support groups online, and I will be a guest speaker for that. My ultimate goal is to go back and start up the groups in person, because it's so much more effective when we can sit with someone and have a discussion and talk to them about what's going on with their loved one, and then they can all sit together and talk too. Even though you can do it virtually, it's so much better when
Yeah,
you meet
it's not the
physically.
same.
But
Yeah,
until then, we do what we can.
right.
I will have families call me, and we use the audiovisual platform. Mine's called VC. It's a HIPAA regulated platform and highly confidential. So we will have consultations online, and
Awesome.
we set up an appointment ahead of time, and then we discuss what their problems are. and what they need to know. Sometimes it just takes one meeting. Sometimes they may meet multiple times, 3 or 4 times a month. I have a few people that are in the maintenance mode right now. I've had a few that were in crisis. A situation, I had a mom that had to be put in an assisted living facility, and the husband passed away a couple of days later from in hospice, and the family was like, they were just torn apart. So there's different reasons that someone may want to talk with me. And sometimes I've noticed they just need reassurance that they're doing a good job. They're doing what they
Wow.
can do. There's no magic. I help increase the awareness of what's going on, why their loved one is doing what they're doing, and what can we do about it. And it's not simple. Everybody's an individual.
Right. And there's
And
no magic.
no, it may be a trial and error. So we
Yeah.
try different things. My techniques and approaches are based on that individual and their background. We have to know their background because that is what pushes their future.
Yeah.
That's what they revert back to, is maybe what they used to do.
Yes.
And we
Yes.
cannot expect them to learn new things. Please don't bring that iPhone at someone who's 90 years old with dementia.
Like, I'm not
Period.
even 90, and iPhones and me don't get along. So,
I mean, the
oh,
intention is
yeah.
very, very good.
Right, right.
But
Yes. But
so
what
we
you're
have to.
doing is so amazing. I mean, whew, so
I
much
love it.
education and training and teaching is incorporated in what you do.
Yes, yes, it is. And now that you mentioned teaching, I've had the pleasure to be an instructor for physical and occupational therapists and some nurses. And depending on which college and which school, they've asked me to speak and to do 6 hour training. I do offer a CE class that's co-sponsored through Commonwealth, and the CEs are offered for nurses and the mental health care professionals and case
Okay.
managers. So I'm hoping that we can start that up again. But I
Yes.
am trained. One of my certifications is through Tipa Snow, the trainer and the
Yes.
consult. The certified dementia trainer and certified dementia consultant is through Tipa Snow.
She's
I do have some
amazing.
other certifications through other companies as well. So I feel like I have a very nice range of different practices. But the amazing thing is, all of them pretty much do the same, just maybe in a different way. And the information, I'm always taking classes to stay on top of what's happening and what's
Continuous
going on with
learning.
the Alzheimer's and the new treatments and drugs. And I've had the pleasure of being asked to be the Alzheimer's mission chair for Fort Worth. So what we're doing with that is, again, raising money for the Alzheimer's walk, and asking people to provide stories about what it is to take care of someone with dementia, including the Alzheimer's dementia, or maybe they personally have it. And so
Right.
we're really trying to let the public know what this is all about. And thank goodness it's successful. More and more people are learning about dementia,
Well,
thanks to people
congratulations,
like
first of
yourself.
all. Well, well, congratulations, first of all. That's amazing. And you are just the right person to be in that chair
Well,
position. So,
I
wow.
appreciate it. It's just
Yeah.
it's my passion, and I'm going to do anything and everything I can to help the public. And if I have to volunteer for all organizations to do that, I'm there as long as I can get some sleep.
I know, right? Yes. But doing what you do is so amazing and inspirational because it's such a need for education, for families, for loved ones, for hospital personnel, for whoever is in healthcare or knows someone. I mean, it's just amazing. I think that your classes should be taught at every hospital, first of all, because I do have a quick story. So when I worked in the hospital on the CVICU, there was a little lady came in. She did have full blown stage 4 dementia. So, you know, hospital settings are not a good environment for people with dementia.
No,
They are
no,
not used to all the beeps, the buzzes. Well, it's not good for anybody if you don't have
especially if they
dementia.
have COVID. And
Exactly. And so to have to be told to stay in the bed, you can't move, you can't do this, you can't do that in the ICUs, it was just, oh my goodness, it was just awful for her. So instead of going to revert to a sedative, it was more like she was waiting for her children to come home from school because that's what she used to do. She was a caregiver at home, and
Mhm.
that's what she was waiting for. So I had to fabricate a story to get her to understand that you're in a hotel and the, your family paid for your
Yes.
overnight stay here, and we're here to serve you, and your children are taken care of. And I had her come out to the nurse's desk and fold towels with me because she wanted to do the laundry. So that's what we did. And
That's
she was
that's
so she
perfect.
was so much calmer, you know, for, you know, being cooperative as we wanted her to be so we could care for
Mhm.
her. But, you know, sometimes those little stories,
You
you go into their
entered
world.
exactly. You entered into her world, and that's that you had to meet her there. Working as
Right.
a speech pathologist, I currently work in an acute care hospital setting, and it's been very challenging working, as you said, someone who has progressed in their dementia, but then you put COVID on top of that, and we walk in with shields, goggles, gowns, very
Scary.
scary,
Hmm.
and families can't see them. It has been extremely challenging on how to help, and I've tried to work with as many as possible. And sometimes it's just going in and working with the staff and I'll say, can you, when you go in there, I want you to get at their eye level and I want you to sing with them. I want you to hold their hand and sing with them and
Yeah.
hum. No words, just hum. And just hold their hand and let them know it's okay. It's all okay. And
Right.
if they are high level enough, we will bring a tablet in so they can see their family on FaceTime, just depending on
Oh,
what level they're at.
right,
We
right,
will find music, that's soothing music. There's just so much we can do with such limitations.
right.
And so what you did is you tried to figure out what is she going to like here? Where is she right now in her dementia and in her world? And
Hmm.
then you got in it, and now she's comfortable. She feels safe,
Well, I would
and
say that's only
that's what it's all
after.
about. It's
Yes, ma'am.
keeping that
Hmm. And that was after I went to it through a
it's
training.
hard.
Mm-hmm. Mm-hmm. Because to be honest with you, the nurses do not get that training in the hospital. Not when I worked in there.
No,
We did
they
not get
don't.
that training on how to deal
Mm.
with a dementia patient in the ICU setting. So I think by me going through that training, that helped me to, okay, I got to go into her world. I can't expect her to come into mine. And so many healthcare professionals, I think they should
Right.
go through that. This is such an important training. And I'm so grateful that you're here tonight to share this
It
with
is.
us. Yeah.
And I hear a lot, well, there's nothing you can do because they have dementia. There is, what do you mean you can't go in there and make them better? And I'm saying,
Oh,
okay, let's back up. And usually when I hear statements, it's like that. It's because they just don't understand. They don't understand what dementia is, and that the environment can make or break this situation. And so I find that as an opportunity to educate
that's
when I
awesome.
hear that type of
Yeah.
statement, and not take offense to it, because people in our world, in our healthcare profession, go in to help. They go in to make a difference. And many of our professionals at all levels don't know what they don't know.
Right.
And so little pieces at a time, me and you and other people, that's what I charge everyone that does understand, is take that opportunity and start trying to educate.
Right.
And they live by example too.
Absolutely.
Live by
Absolutely.
example. So
Wow.
it's there's not anything magic. Um, what you did that one day with that lady, it may not work the next day.
It may not, yeah. And it probably
So
didn't.
so now we have to figure out what's going to work
Right.
the next day.
Yes, it's like, okay, what game are we gonna play today? Because we got to make this, better for her and better for yourselves as well. So,
Yes. And our
right.
caregivers have their burnout. There is an actual
Mm,
diagnosis for caregiver burnout, and the stress, because it's always changing. There's not just one technique that works every single day, and they have to be detectives, and they always have to be detectives. And if a caregiver is watching us right now, I want you to be sure that you take care of yourself first.
oh, yes.
You really need the break. Do not feel guilty leaving mom or dad, with some friends or family, or even maybe
Mm-hmm.
at a facility for a day or two for
Yeah.
respite.
Right.
Number one is you can get sick yourself from all this stress and not taking care of yourself. Number two is you're no good to your mom or dad if you're sick. And then that adds more stress to you.
And
So
then,
I
mm-hmm.
spend a lot of time working with caregivers in that area. And what can you do now to relieve some of the pressure that you're receiving right now? Because this is a 24-hour, 7-day a week job.
Oh, yes, yes. Well, Janet, what you are doing is truly, truly amazing. So let's go back and reiterate. So you do groups,
Yes.
especially now that COVID is kind of, we're praying that it's getting ready to stabilize, be controlled, because I believe it's here to stay. But you do groups, you teach, you go to churches, hospitals, home health companies,
Yes,
stop me when
senior
I'm
living,
wrong.
right,
Yes.
senior living communities. And I do go in, well, I was going into homes. I'm still available on the audiovisual platform. I actually speak at different groups, civic organizations like the Lions Club and Rotary Club and
Good,
those type
good.
of places, and the Chamber of Commerce's, when they, again, as a guest speaker. And so I'm available to speak with support groups if they need someone to talk about dementia with the caregivers. Also available to speak with groups of people that aren't always involved with someone living with dementia, but they are exposed to it, like our
Right.
elder care lawyers,
Yeah.
banks, any business. They
Yeah.
need to be, when someone walks in their business, they need to know something's not right here. I'm wondering, and automatically change their way of dealing with that person.
Right.
And of course, first line responders are extremely
Wonderful.
important. It can
Yes.
make or
Oh,
break a
yes.
situation.
Oh,
Yes,
yes, I can
yes,
see that. Yes, absolutely. Well, what you're doing is amazing. So, if someone wanted to learn more about the classes you teach or the groups that you provide your consultations for, or that Dementia Live, which should be a walk in their shoes. I just changed the name. How would you prefer them to get in touch with you?
Okay, I do have an email address, and that is janet@jstandiferconsulting.com. I do have a website, and you can email me on my website. And if you Google J Standard for Consulting or Dementia in Perspective, you would be able to go directly to my website. And if you would just like to call me and leave a voice message, if I don't answer, that number is 817-901-4658. And I'm very good at returning calls by the end of the day.
Yes. Mhm.
If you need something urgently, and then we can take it from there.
Wonderful,
I
wonderful.
believe
Well,
that's
Miss Janet Standifer, Thank you so much. She is the dementia care consultant, educator, counselor, instructor, however you
Whatever I
want.
need to do.
Yes, because it sounds like you do it all. Support, for emotional support, because that is definitely a key factor in what you're doing, giving that emotional support.
A huge, huge part of
Yes,
it. Yes, ma'am.
yes. Well,
And
thank
thank
you
you.
again.
I
Oh, thank
appreciate you
you.
letting me speak with the group, and hopefully we can talk down the road.
Absolutely, absolutely. Well, thank you again. This is Deidre Kindred, your nurse advocate on Health Chats Among Friends. Tune in next time for another amazing service. Have a good evening.